This is Kemi Osukoya reporting from the White House. Behind me is a red ribbon, as you can see. That's because today is the World AIDS Day, and the Biden administration, to commemorate that event, President Joe Biden invited members of the Congress to the White House. The president is addressing the nation right now, and during his remark, the president is expected to announce his administration new national HIV/AIDS strategy that will accelerate research and also treatment for HIV and AIDS patients in the country and also abroad.
Down the stigma and disinformation that still exists around HIV/AIDS, I want to thank you. Thank you for your voices and for putting your hearts into your work, because that's what you do. You put your hearts into work, and people can tell. It's because of all of you and the dedication of scientists and activists around the world that we've been able to dramatically reduce new HIV transmissions and make individuals with HIV today lead long and healthy lives. And you know, it's because of the persistence and resilience of the HIV community that we've changed so much about the way we approach healthcare research and equitable access to services, even relationship between patients and healthcare providers. You know, and it's because of you, and it's not hyperbole to suggest it, that we are within a striking distance of eliminating HIV transmission, within striking distance. And I think everybody but Nancy couldn't have imagined us being there 40 years ago. But the fact is that when CDC reported the first case of what we now know as AIDS, it's something that we couldn't fully imagine even 20 years ago, before the landmark investments that the United States made through PEPFAR and President's Emergency Plan for AIDS relief. But you made it possible. You made it possible, and I want to take this moment on this historic anniversary to acknowledge the incredible passion and the work that got us here. Because I know that so many of you, this is personal. Today, we once more raise a two-story tall red ribbon on the North Portico of the White House to remember how far we've come, to work we have left to finish, and so we never forget the price that's paid all along the way. And so many of you know, and relations with people who have, whether they're family members or friends, that you've watched them in the past wither away. In the past 4 decades, as has been mentioned, an estimated 36 million people, including more than 700,000 here in the United States, have died of AIDS-related illnesses. Think about that. That many people, more than almost all the modern wars combined, all the wars combined. Here at home, we saw entire communities devastated by this disease, particularly among the LGBTQ plus individuals and members of racial and ethnic minority groups that they've already spoken to. And a generation endured the brunt of this epidemic, losing friends, loved ones, family members, partners, instead of being seen and being recognized. And I can recall, if you excuse a point of personal privilege, being, I think, in this very room when a senator he's deceased now, so I don't want to mention his name because he can't defend himself, but standing up and saying, along with another guy named Jerry Falwell, this is God's punishment, paraphrasing it, God's punishment, finally. Think how much has changed. I mean, back in those days, the willingness of other members of the Senate and the House to stand up and take him on Nancy was there, many of you were there, but it wasn't a universal thing. It wasn't a universal thing. But you all demand to be treated with dignity and with equity. Those voices, those stories are invaluable as we recommit ourselves to finishing the fight that we are going to make for these individuals living with AIDS and are helping them drive and inform our efforts at every step of the way, because we're going to finish this fight. And so when my administration came to office, not only did we reestablish the White House Office of National AIDS Policy, which hard to believe. I don't deserve any credit. That was the easiest possible thing to do. No, I really mean it. Think about it. Think about it, that it gets a round of applause in the year 2021 when we say that. I mean, it should have never, ever, well, I don't want to get into that, but anyway. And I've asked Harold Phillips to lead our efforts. Harold, stand up. Harold, I think they know you. Harold is dedicated, he has decades of experience working with to end AIDS, the HIV epidemic, and I want to thank him for his leadership and willingness to join the administration and releasing the National HIV/AIDS strategy for 2022 to 2025. That's what he's doing. It's a roadmap for how we're going to put our foot on the gas and accelerate our efforts to end the HIV epidemic in the United States by the year 2030. That's the goal. And it centers on the kind of innovative community solutions, community-driven solutions that we know will work. It's a plan to make sure that the latest advances in HIV prevention, diagnosis, and treatment are available to everyone, regardless of their age, race, gender identity, sexual orientation, disability, or other factors. It shouldn't matter where you live in the country, or how much money you make, or how you respond, or how we have to respond across the board to HIV epidemic everywhere and support all people living with HIV. And critically, this strategy takes on racial and gender disparities in our health system that for much too long have affected HIV outcomes in our country to ensure that our national response is a truly equitable response. So we're going to take aggressive action and back it up. We've asked Congress for $670 million in historic budget request for the Ending the HIV Epidemic in the United States initiative. And I'm confident we're going to get that done. Right, team? We've got some great congressional champions for this work here today, starting with a woman, as I said, I've already mentioned, as she a leader of the issue from the moment she set foot in Congress, starting with Nancy, but also Representative Barbara Lee. Barbara Lee. Maxine Waters. I learned a long time ago, when Maxine says, I have an idea, just say yes. Just say yes. And Sean Patrick Maloney. Sean. Jennifer, David Cicilline. David. And Jennifer Gonzalez-Colon. Thanks for all you're doing. I was going to say, not for your support. This is sui generis with all of you. You're just incredibly committed to this. And it's an issue that has a long history of bipartisan support. So looking forward to working across the aisle, God willing. I want to make sure that everyone in the United States knows their HIV status, that everyone with HIV receives high-quality care and treatment that they deserve, and that we end the harmful stigma around HIV and AIDS. In particular, there's still a large number of states that have HIV criminalization laws that do not reflect an accurate understanding of HIV. For example, HIV cannot be transmitted through saliva. There are still laws in the books that criminalize spitting by people with HIV. I mean, this is 2021, United States of America. But we have to follow science, and that means eliminating laws that perpetuate discrimination, exacerbate disparities, discourage HIV testing, and take us further away from our goal. We can do this. And as we accelerate our efforts at home, we're not going to let up on the efforts to fight HIV/AIDS globally. Leading reauthorization PEPFAR in 2008 was among the highlights of my time as chairman of the Foreign Relations Committee. And at the time, by the way, I was not one of the great leaders in this. I always supported the effort, but it was because I was chairman of the committee. And believe it or not, there was a Republican president, and I'm not being a wise guy when I say this, who pushed for PEPFAR as an undeniable proof of the good that American leadership and innovation can achieve in the world when we commit to it. We have a moral obligation to do that and continue. Since President Bush launched PEPFAR in 2003, we've saved more than 21 million lives. We've prevented millions of HIV infections, and we've helped at least 20 countries bring their HIV epidemics under control or reach their UN AIDS 90-90-90 treatment targets. That means 90% of the people living with HIV in a country will know their HIV status. 90% of HIV positive individuals are able to access treatment, and 90% of those receiving treatment for HIVs will have suppressed viral loads. That's within our power. We're doing that. And through PEPFAR, the United States will support nearly 19 million men, women, and children with life-saving HIV treatment. It's an incredible, incredible achievement. Those are not the only lives saved, though. They're communities that are strengthened by the talents and contributions of HIV-positive individuals who are here today leading productive lives and leading the community because of what you've all done. And as we have faced COVID-19 pandemic, we've also reaped additional benefits from our decades-long investment in strengthening health systems around the world through PEPFAR. Working through the CDC and USAID, PEPFAR supports more than 70,000 case care facilities, 3,000 laboratories, and nearly 300,000 healthcare workers across 55 countries, all of which have been vital in supporting the global fight against COVID-19. By strengthening countries' ability to fight AIDS, we've also...
Separately, the President's Chief Medical Advisor, Dr. Anthony Fauci, reported today during press briefing that just ended that there is a confirmed case of the COVID-19 Omicron variant in the U.S. A California resident that recently returned from a trip from South Africa tested positive and have mild symptoms. The individual is currently quarantining right now. There has been a tracing, and everyone associated with him have tested negative. During the briefing, the Dr. Fauci used the opportunity also to urge all Americans. There are more than 60 million Americans that are unvaccinated right now, and they have been urged to make an appointment with the new variant from South Africa. This is more reason why people need to make an appointment to get a COVID-19 shot.
Okay. Unpopular demand and request of the press corps, joined today by Dr. Fauci, who will give a brief statement and then answer some questions. He does have a heart out a little bit after 2, so we're going to get to as many questions as we possibly can. With that, I will turn it over to Dr. Fauci.
Thank you very much, Jen. So, as some of you may have heard, the California and San Francisco Departments of Public Health and the CDC have confirmed that a recent case of COVID-19 among an individual in California was caused by the Omicron variant. Genomic sequencing was conducted at the University of California at San Francisco, and the sequence was confirmed at the CDC as being consistent with the Omicron variant. So I know there are a lot of questions, but here's what we know right now. The individual was a traveler who returned from South Africa on November 22nd and tested positive on November the 29th. The individual is self-quarantining, and all close contacts have been contacted, and all close contacts thus far have tested negative. The individual was fully vaccinated and experienced mild symptoms, which are improving at this point. So this is the first confirmed case of COVID-19 caused by the Omicron variant detected in the United States. And as all of you know, because we've been discussing this, we knew that it was just a matter of time before the first case of Omicron would be detected in the United States. And as you know, I've been saying it, and my colleagues on the medical team and others have been saying it, we know what we need to do to protect people. Get vaccinated. If you're not already vaccinated, get boosted. If you've been vaccinated for more than 6 months with an mRNA, or 2 months with J&J, and all the other things we've been talking about getting your children vaccinated, masking in indoor congregate settings, etc.
As we know, we are entering the major holiday season right now, and people are going out shopping. We just done the Thanksgiving, so Americans are worried. Everyone is worried, so Dr. Fauci said this is more reason. The more vaccinated people are, the better chances that people have of protecting themselves from the virus. You just came out of the president's remark. Can you talk about that, please?
Yes, absolutely. So the president just presented an update to the National HIV/AIDS strategy, and it was so exciting to be in a space to hear about our bold ambition of ending the HIV epidemic by 2030 and acknowledging the fact that we have to have health equity and address the full range of challenges that are facing communities most impacted by HIV. So it was inspiring. We have a lot of work to do here in the midst of still battling the COVID pandemic along with HIV, but recognizing that we definitely have the collective power to accomplish the goal.
So what are you seeing currently right now in your community that you advocate for?
Well, we're actually seeing a lot of leadership coming up from the ground. So our grassroots communities truly have been empowered even during COVID to provide support and resources within their communities. So we're seeing a boldness and visionary leadership coming out of our communities that's really exciting. What we're also seeing is that due to COVID, there was a serious reduction in the amount of HIV testing and screening and prevention services that could be offered. So we're also in the midst of trying to play catch up to a degree to address the unmet needs that happened during the pandemic as well. So there's a lot of work to do, but there's also a renewed energy and leadership in the fight as well.
Do you see people, because like when COVID first started, people were afraid, just like 40 years ago during the AIDS pandemic. And some people are making references to that right now. Do you see any comparison during that period and what we're going through? We just find out there's a new variant in the US. And people are very worried. This is the holiday season.
Absolutely.
People are shopping, we are looking forward to have an holiday with our families. Can you?
Sure. I mean, we've been reassured that if we do the things we need to do to protect ourselves from COVID, that the variant does not have the catastrophic impact that it could have. So I think similar to the fight in HIV, it's like we know those things we need to do to protect ourselves and protect our communities. So there's no need to even create there's a lot of misinformation, there's a lot of fear, there's a lot of stigma around both HIV and COVID. And if we as a community would unite and do those things that we know science tells us will prevent the spread, then I think we would definitely see ourselves on the other side of the COVID pandemic, and we would see a significant reduction in new HIV in our communities, particularly in the South where we do our work.
Okay. And especially among minorities.
Yes.
So there is a lot of, there's still hesitation about getting the COVID vaccine.
Medical mistrust is well documented. It's historically makes complete sense why there would be a distrust of the healthcare system in this country and across the world. But we also have to trust that there have been strides made in the representation of who's creating these vaccines, who's involved in the cause of making sure they get into our communities. So there's a lot of education that has to happen, and we have to combat that misinformation to make sure that our communities get the health care that they need. And I do think that COVID has really raised a lot of awareness around vaccines and research, and why communities have to be a part of that and participate in that to make sure that our voices are heard throughout the process.
What is your message to the LGBTQ community especially?
Yeah.
Because they're still struggling with the virus. So what's your message today?
My message would be that all folks matter, that everyone is important, that LGBTQ folks should see themselves in the healthcare system, that, you know, while we talk about the fact that everyone should have access to HIV prevention and care and services, everyone should have access and have an opportunity to have healthcare services that are non-stigmatizing, that are affirming and supportive. And so my message would really be for healthcare providers to do a better job, to provide services and resources and support that are affirming to LGBTQ plus folks and the community at large. If anyone who walks through the door in need of those resources, they shouldn't be stigmatized or judged, no matter who they are when they come in the door to get services. And that's really the bottom line.